Today's topic is lumbar vertebrae. Before knowing about the lumbar vertebrae, we should know an overview of the whole vertebral system. So vertebrae actually coming into the axial skeleton, while the other axial skeletons are from top to bottom, skull with mandible, then all these vertebrae, cervical 7, 12 thoracic, 5 lumbar, 5 sacral and 3 to 5 coccygeal. Total 33 vertebrae are there, and ribs with sternum. So these are all coming into the axial skeleton. So all these 33 vertebrae, they are forming a canal through their vertebral foramen, which is giving protection to the spinal cord, and it is helping for weight transmission. So now we will see the basic feature of any vertebra. The basic structure of a vertebra is composed of body and the posterior arch. This body and the posterior arch, they are connected both sides by the pedicle. Okay, if you see from side, it's the pedicle, vertebral arch. In between these two vertebral body, there will be intervertebral disc. And this arch and the vertebral body, when they are joining with the help of pedicle, they are forming the vertebral foramen. When two vertebrae are joined each other, they are making intervertebral foramen. So this is vertebral foramen and this is intervertebral foramen, through which the nerve roots both sides with the vessels coming out. Posteriorly, the vertebral arch, you see the vertebral arch is having 7 processes. One is superior articular process, inferior articular process, superior articular process, inferior articular process on both sides, transverse process both sides, then spinous process. So 1, 2, 3, 4, 5, 6 and 7. These are 7 processes of the posterior arch. And this part is the lamina, which is joining, and from this spine is appeared. So if we compare with the cervical, lumbar and thoracic vertebra, just the basic differences we will separately study afterwards. In the cervical vertebra, we will get the foramen in the transverse process, and in most of the vertebra, the spine is bifid. Whereas in the thoracic vertebra, we will get the spine is inclined, and we will get here the facets for the ribs. But in lumbar vertebra, doesn't have neither foramen transversorium nor any facet for the ribs. So in this way, immediately we can differentiate the lumbar, cervical and thoracic vertebra. Another important difference when we compare with the shape of the vertebral foramen, we will see the foramen is triangular here. The vertebral foramen in the thoracic level is circular, whereas the vertebral foramen in the lumbar is triangular. But we can easily compare the vertebral foramen is largest in the cervical. Okay. Because the cervical enlargement of the spinal cord, we have already studied brachial plexus, the extra nerves which are coming out to supply the upper limb, so that's why the cervical enlargement and the size is bigger in this cervical vertebra, okay, which is not there in the lumbar vertebra. Because the spinal cord ends at the level of the L1, so this is L5, L4, L3, L2, L1. So this is the level where spinal cord ends. So there will be no spinal cord in the lumbar spinal canal. So we will get the chorda equina. The bunch of nerves are coming down and coming out through each foramen, but spinal cord ends at the level of L1. That's why we are not getting any enlargement of the spinal cord. This lumbar level is already ends at the level of L1, whereas in the cervical levels, because of this cervical enlargement, the vertebral canal is bigger, triangular in this cervical level. If you see the pedicle is coming out from the posterolateral surface of the vertebral body and joining with the vertebral arch, and that is having two notches, superior notch and the inferior vertebral notch. So when it is joining with the other vertebra, so then the inferior notch of this upper vertebra and the superior notch of this lower vertebra, that is forming the intervertebral foramen on both sides, through which the nerve root and the vessels are coming out. So now if you see the lamina, so the posterior end of the pedicle, the lamina appears and coming posteromedially. So you can see this posteromedially, both the sides they are coming posteromedially and joining in the middle, from where the spinous process is appearing. So where the two lamina they are joining, and from there in the midline the spinous process is appearing. Now if you see the superior articular process and the inferior articular process, which are forming the facet joint, you can see the inferior articular process of the upper vertebra joining with the superior articular process of this lower vertebra and forming the facet joints on both sides. In that way, both the vertebra are joined anteriorly with the intervertebral disc and posteriorly by these facet joints. Another very important thing, if you see the articular surface of the superior articular process is always facing posteriorly, whereas articular surface of the inferior articular process facing anteriorly. That is very important thing to hold the vertebra in anatomical position. You can hold it like this way, but this is not the actual position of the vertebra, because we can see the articular surface of the superior articular facet should not be anterior, it has to be posterior. So when you are holding like this way, the articular surface of the superior articular process is posteriorly facing and articular surface of the inferior articular process is anteriorly facing, then it is in anatomical position. And at the base of the superior articular process, you get a small tubercle, so that is called the mammillary process. Both the side will get at the base of the superior articular process, the mammillary process. So now coming to the transverse process. So you can see this was the pedicle, this was the lamina. So at the joining point of the lamina and the pedicle, the transverse process appears and it is projected laterally. Transverse process, it is having tip, and posteriorly we are getting a tubercle, that is called the accessory process of the transverse process. And in the anterior surface of the transverse process, laterally we will get a ridge which is dividing this transverse process into medial and the lateral part. We will discuss later the attachment of these muscles and the thoracolumbar fascia afterwards here. So now we will see that out of all these 5 vertebrae, upper 4 lumbar vertebrae, they are called typical vertebrae, whereas the 5th lumbar vertebra is atypical. So it must be having some different features that will be discussed now. This is the largest vertebra, it's a huge body, kidney shaped, same like the other typical vertebrae. Anteroposterior diameter is lesser than transverse diameter. If we see the height of the vertebral body, the anteriorly the height is little more than posteriorly. It's little bit wedge shaped. And because of that, when it is attached with the sacrum, there will be a lumbosacral angle. It's almost 120 degree. If we see the transverse process, Transverse process is very small, and it is almost attached with the pedicle and body. That is not there in the other typical lumbar vertebrae. Okay, if we take an imaginary line between this superior and the inferior articular process, they are almost parallel, whereas in other lumbar vertebrae they are little bit inclined. So if you see the posterior surface of the vertebral body, you can see is the basivertebral foramina through which the basivertebral vein is passing with some nutrient arteries. You can see here also clearly the basivertebral foramina in the posterior surface of the vertebral body. So now, after knowing about all these lumbar vertebrae, though we know upper 4 vertebrae are typical vertebrae and lumbar 5 vertebrae is the atypical, but to differentiate each and every lumbar vertebrae, one rule can be followed, that is the facets rule, where if we see vertebra from posteriorly and draw a schematic picture of the body where the articular processes are in 4 corners, we will see the shape of the L1, L2 vertebra is looking like trapezium. The L3 will be looking like a rectangular where the vertical heights are more. L4 will be almost square, and L5 rectangular but the horizontal lines are larger. So in that way we can differentiate all the lumbar vertebrae. Now we'll see the attachment of different muscles and ligaments around the vertebra. So if we see all the lumbar vertebrae, not only the lumbar vertebrae but anterior surface of all the vertebrae throughout the length, attachment of this anterior longitudinal ligament, which is binding all these vertebra as well as the intervertebral disc. So anterior longitudinal ligament attached to the anterior surface of the vertebra. In the same way, posterior longitudinal ligament is attached to the posterior surface of the vertebra throughout the vertebral column. Now, once you remember the attachment of the crura of the diaphragm, so both sides, right crura and the left crura, right crura of the diaphragm is attached to the upper 3 lumbar vertebrae, 1, 2 and 3. So this is the attachment of the right crura of the diaphragm, whereas the left crura of the diaphragm is attached to the anterolateral part, the upper 2 lumbar vertebrae. So now coming to the lateral surface, where we will get the attachment of the psoas major. Psoas major is originating from all the lumbar vertebrae, body, intervertebral disc and up to the medial part of the transverse process. Both sides, psoas major, all the lumbar vertebrae. If we see the joints between these 2 vertebrae, anteriorly they attached with the intervertebral disc and posteriorly they are attached with the superior and the inferior articular process, which are forming the facet joint, where if you see the articular surface of the inferior articular process, it is convex, whereas the articular surface of the superior articular process is concave. So in that way, this joint is only permitting more in the flexion extension, whereas they are preventing the lateral rotation. And this is a plain synovial joint. And if you see the intervertebral disc, so that is secondary cartilaginous joint, where the lower end plate of the vertebra is the hyaline cartilage and upper end plate of this lower vertebra is hyaline cartilage. In between intervertebral disc is the fibrocartilage. So that's why this is forming the secondary cartilaginous joint. We know the other example like symphysis pubis. So if we see the transverse process, then we'll see in the lateral part we'll get a small ridge which is dividing this transverse process into medial and the lateral part, where the thoracolumbar fascia anterior layer is attached on this ridge. So medial to this anterior layer we'll get the psoas major, and the lateral to this anterior layer we are getting the quadratus lumborum. And the middle layer of the thoracolumbar fascia is attached to the tip of the transverse process, and the posterior layer of the thoracolumbar fascia is attached to the spine of the vertebra. In that way, the three layers are attached to the different parts of the lumbar vertebra. Now coming to the other ligaments. So in between the two spine, we are getting supraspinous and interspinous ligament. In between the two transverse process, we are getting intertransverse ligament, and in between the lamina of upper and the lower vertebra, we are getting ligamentum flavum. If I describe little in detail if we imagine this vertebra, the ligamentum flavum is coming the upper border of the lamina and going up and attached to the inner side of this lamina of the upper vertebra. So if we see the vertebral foramen, so in the vertebral foramen you can imagine the spinal cord with the meningeal coverings are there. So most outer covering is dura mater. The space between the dura and the periosteum of the vertebral foramen, we are getting the epidural space. Epidural space starts at the level of the foramen magnum and it ends at the level of the sacral hiatus. So that is the extent of the epidural space where anesthetists are giving epidural analgesia, epidural anesthesia. Whereas the subarachnoid space ends at the level of S2 and spinal cord ends at the level of L1. From there, bunch of nerves are coming down for the lower limb, so they are called the chorda equina and they are coming from respective foramens. Sometimes L5 vertebral transverse process, it attached with the iliac crest and it is becoming one of the sacral vertebra, so that is called the sacralization of this lumbar vertebra. So L5 will be part of the sacrum. In the same way, when the S1 vertebra is separated and coming up, so that is called the lumbarization of the sacral vertebra. So the sacralization of the lumbar vertebra, this may happen, or the lumbarization of the sacral vertebra, both can happen. Now we have learned many features of the vertebra with their attachments. If we again consider what are the functions of the vertebra, so you will see first the protection of the spinal cord, second transmitting the weight, third if we now see how the facet joints, the superior articular process, inferior articular process, making this facet joint, it is actually preventing the vertebra to anterior dislocation. If any time any injury occurs at this level, so then this anterior dislocation happens, which is called the listhesis, anterior listhesis or posterior listhesis. So in that way, the protection of the anterior dislocation is done by this facet joint. Now coming to the other thing, if you see vertebra in this way, the two transverse process and midline, the spine, so they are acting as a lever with the help of all these different muscles and the ligaments. When the vertebral column is moving in different direction, so they are acting as a lever, as a whole. So these are the different functions of the vertebral column. Now, before knowing about the ossification, we should recapitulate a little bit about the embryology. We know the vertebrae are developed from the somites, which is developed from paraxial mesoderm. Now, somites is differentiated into sclerotome and dermomyotome. From the sclerotome, the mesenchyme cells migrate and condense around this notochord. So we know if this is the intervertebral disc, already you have studied the nucleus pulposus, which is the remnant of the notochord. You can imagine here, notochord is here and the neural tube is here because the spinal cord is here. So from the sclerotome, the mesenchyme cells is condensing around the notochord, which is from the centrum, and mesenchyme cells are migrating around this neural tube, forming the right and the left neural arch. And in the body wall, little proximal to this neural tube, we are getting the costal process. So the body of the vertebra is developed from the centrum. From this two neural arch, the pedicles, transverse process, lamina, superior, inferior articular processes, spines, all are developed. And from this costal process, the costal element of the transverse process is formed. And mainly, this costal process is forming the ribs in the whole thoracic region. Now, if you see the ossification of the vertebra, so one primary center is appearing for centrum, two primary centers are appearing for two neural arch at about 7 to 8 weeks of intrauterine life, where the centrum is fused by 1 year and this neural arch is fused by 6 years, and the secondary centers are appearing in puberty, one on both sides for the transverse process, one for spinous process, two for mammillary process, and two annular epiphyses appearing for the upper and the lower part of the body. They all fused by the age of 25 years of age.